我係黃秀梅，加入愛政黨嘅自由黨嘅候選人。就今次咧，我係re-election 關於2014嗰個大選。So there are 4 major issues in Scarborough Aging Court. So I want to go through each one of them. Number 1 issue when it comes to Scarborough is health care, education. The transit issue is very important, as well as jobs. So all of you know, before I became a member of provincial parliament, I was a former school board trustee with the Toronto District School Board, and I was also a registered nurse. So both of these issues are very important to Scarborough Aging Court residents, particularly when it comes to full-day kindergarten, meaning this September, all 28 elementary schools in Scarborough Aging Court will have full-day kindergarten. As well, the residents in my riding, especially those who are going to university or already in university, are very concerned about the potential elimination of the 30% of the tuition fee for both post-secondary colleges and universities. The other piece is very concerning right now is that in my riding of Scarborough Aging Court, there are a lot of seniors. As we know, more seniors in your community will need more health care required. So that's why our plan in terms of keeping seniors at home is working. And I know that many of my colleagues here will share with you that keeping seniors at home is the right thing to do. And recently, in my riding of Scarborough Aging Court, we also opened the first ever nurse practitioner clinic specifically dealing with mental health. And you know that in our culture, talking about mental health is considered a taboo, a stigma. So by having the care in the community is the right thing. And the care is not just about nursing, it's also about social work. There are social workers there. There's also housing support for those who are with mental health, as well as dietitians. So there's a wraparound care, not just in nursing, but there's also a physician, a psychiatrist, and a family doctor. As a matter of fact, the family doctor working at the nurse practitioner clinic was used to be one of my students. So at the end of the day, we're also very concerned about what Sandra talked about is the transit piece. We have a plan of 10 years to ensure moving Greater Toronto Hamilton area. Here in Scarborough Aging Court, we have a lot of transit issues because we know that transit moves not just the traffic, it also deals with healthcare issues, it also means jobs. So when you build the infrastructure, it also means jobs for our community. So I'm very pleased to be here with my colleague because we need to have this conversation with the community. Michael? So I'm going to talk about the insurance piece, okay, Joseph? I know since last year the government made a plan, a commitment to reduce the auto insurance by 15%. And I know from the insurance broker information in my riding of Scarborough Aging Court, on average, so average it out, it's 5.12% just this year, okay? So it's a total of 15% over 2 years. So they already start reducing the insurance cost, the premium. So in my riding of Scarborough Aging Court, average is 5.12%. So some insurance company may be even at 6 or 7 or even over. But over 2 years, there's a commitment from the Liberal plan is to reduce the auto insurance by 15%. The other piece that the public also need to know that we are working with different law enforcement like the OPP and others to deal with the auto insurance fraud because all of us are affected by the fraud. So before the government was dissolved, that the Attorney General's office, along with the Ministry of Community Safety Correctional Services, that's the OPP, was dealing with the fraud task force. The other piece you also heard is the health insurance fraud, right? So some of the chiropractor was recently charged by York Regional Police dealing with frauds, okay? So everybody is affected when that fraud happens. So I want to be very, very clear, the auto insurance piece, there is commitment from the Liberal plan to reduce the car insurance by 15% over 2 years. But the key piece here is that we have to work together because when you deal with insurance, if there's fraud, everybody's affected, okay? Anything else?